The definition of the concept of exposure is quite wide. It's probably a little bit more than what we normally think. And if you look at the various types of exposures people have with toxins in the environment and at the workplace, there's quite a bit of overlap, but nevertheless, these are the classical categories of exposures. I guess at the very top of the list, and probably causing the greatest impact overall, rightfully so, are the so-called personal exposures, the things we choose to expose ourselves to, like drugs, like alcohol, like tobacco, as well as the substances which we take through medical necessity, medications. There's a whole area of outdoor air pollution, indoor air pollution, industrial exposures, which overlap with the agricultural hazards, natural toxins, and even things like radiation and physical injury can be regarded as exposures, in that we have our bodies in the environment and we get exposed to these various things. And this is going to be the main brunt of this chapter. At the very, very top of the list, and of course, by far the most preventable cause of death in the United States, is a personal exposure, a personal choice called tobacco. I guess by a good definition, it's not a choice because, like most other addictions, these are things that the person really has no control over. Nicotine is an addicting substance, so I'm not too sure how strong the word choice really matters in this. There's about 500,000 premature deaths in the United States from tobacco. Its main effects are in cancer, respiratory diseases, and cardiovascular diseases. It has a tremendous, therefore, cost in health-related costs, estimated 150 billion. You know, these numbers might not seem very big these days, considering with some of them that have been thrown around during the election here. But it's a single most preventable cause of death in the United States. And even though we all know, and the industry has always known for many, many years, it is a cause of lung cancer. 70% of all lung cancers are caused by tobacco. About a third of all other cancers are related to tobacco as well. So we have to keep that in mind, and especially things like bladder, urinary tract. These are all have a very, very strong relationship to the substances found in the tires. Remember, it's the nicotine that gets you hooked, and it's the tires that does the damage. What are the compounds? Well, often the generic term polycyclic aromatic hydrocarbon is thrown out. Sometimes they'll throw out little acronyms like NNK and NNN, standing for things which will take you a half hour to pronounce. Remembering that polonium, the isotope polonium-210, is also a significant carcinogen as well, independent of the polycyclic aromatic hydrocarbons and the NNNs and NNKs. So let's take a look. In the lung, of course, all substances play a part, as well as in the upper respiratory tract. In the esophagus, the N-prime nitrosononicotine is the single most indicted causative agent. In the pancreas, NNK, and I'm going to try to pronounce that for you, and I know I'm not going to get it correct, but NNK is 4-methyl-nitrosoamino 1,3-pyridyl 1-butanone. Okay, I think I did it. In the bladder, the naphthylamines from tobacco smoke, from the tires, play a very, very strong role. In the oral cavity, generally the same compounds as in the lung and upper respiratory tract. Also, it's probably not even worth separating these. If you just remember the polycyclic hydrocarbons, NNK, NNN, polonium, basically have roles in cancers of the lung, upper respiratory tract, GI, urinary tract, and these are the main cancers. To give you an even more scary diagram, which I have tried to decaffeinate for you, if you look at all of these data here, it represents risk factors with a little bit of difference between men and women. But if the thing you want to take home from this careful study is that if you want to generalize, smokers have a threefold risk of atherosclerosis relative to non-smokers. They have a tenfold risk of emphysema, and they have a 20-fold risk of lung cancer. And if you take the other types of cancers which are not classically lung, that varies from about 3 to 10-fold. So once again, as we said before, the main effects of cigarette smoke is on blood vessels, lung, and a neoplasm. In the workplace, cigarettes have an important role, especially with regard to secondhand smoke. A lot of people are concerned with secondhand smoke, and there's a lot of confusing studies. And I just want to give to you the undisputable facts to try to clear up a lot of the baloney we hear about secondhand smoke. We hear studies estimating widely what the risks are, but the generally agreed upon conclusion is that there is a measurable and statistical increase in risk for cardiovascular disease and cancer. But rather than being a 4 to 10-fold risk, which we saw for the smoker themselves, it's probably less than 2-fold. Okay, it's in the range of, maybe 50, 60, 70%, but definitely it's not nearly as high. It's approximately 1/10 as high as the smoker himself. And that probably makes sense, but it's still statistically right there. And of course, in the workplace, if you take the work-related lung diseases, pneumoconioses, exposures to silica, coal, dust, cigarette smoke tremendously exacerbates those conditions. So workers who are at risk for lung diseases are tremendously exacerbated by the presence of cigarette smoke as well. Those are the two things you should kind of take home with you. And let's talk about the single next biggest personal exposure, which we'll probably spend the most amount of time on, and we'll talk about alcohol. The statistics always appear that there's about 1 in 10 people that we know are alcoholics. That's a good rule of thumb, because we all know somebody or have somebody in our family or some close friend, or the social and medical diseases that alcoholism produces always reflect on the close people around them. And alcohol is directly responsible for about 100,000 deaths a year. Not quite as big as tobacco, but still pretty big. And it also has an economic loss about the same as tobacco, mostly because of absenteeism and work-related issues. About an economic loss of about $130 billion a year. Now, you'll probably spend the rest of your life trying to decide what is an alcoholic. And you're going to hear all kinds of crazy stories, but that decision is ultimately going to be yours. I'm not going to try to define it for you. I personally think that I can't think of anybody who drinks more than 2 drinks a day that is not an alcoholic. That's my personal opinion, but it has more of a social definition rather than just a quantity definition. And very often when you go to talks where alcoholism is discussed, you'll always have the little statistic, well, you know, there's 1 million studies showing that if you have a little bit of alcohol, that's good for you. Well, let me tell you, the only thing I could think of that a little bit of alcohol does is lead to more alcohol. So whenever I hear this little statistic thrown in, I always know that's a drinker that's presenting the data. And let's drop it at that. And once again, as we said, somewhere along the line, in your life, hopefully sooner rather than later, you're going to understand the definition of alcoholism. I thank you very much.